Agency is warning that the potentially fatal Mpox virus is becoming a global threat. Cases on the continent have surged by, look at that number, 160% compared to the same period last year. Joining us with more now is Dr. Isaac Bogoch, an infectious diseases specialist. Good morning to you, doctor.
Hey, good morning, Lindsay.
Okay, so Mpox, we know it's already here. The latest data we have, reported by the Public Health Agency of Canada, that number, 1,515 cases. The latest data we have was from September 2023, so who knows where that number is right now. Specifically, though, Toronto has had a big spike this year. Why is this spread why is it becoming so rapid?
Yeah, well, there's different epidemiology in Africa and in Canada, and said with love, respect, with no moralization and with no stigmatization. But the Canadian epidemic, over 97% of cases are in the men who have sex with men community, and that's why most of the public health messaging and the public health initiatives have really been focused on that cohort. And in fact, huge credit to the men who have sex with men community, because they've led the public health charge. They've led community leadership, has led the communication, has led the vaccine rollout, and ensured that vaccine clinics were placed in areas where people in that community would be more comfortable going. And of course, we definitely have seen more cases in 2024 in Canada than we did in 2023. But it's important to recognize that it's slightly different than what's being seen in Africa. Having said that, we know that what happens in one part of the world can rapidly affect us on another part of the world, as we've seen with many other infections.
Absolutely. We're all familiar with that. So what kind of symptoms does Mpox have?
Yeah, so people will have systemic symptoms. They might feel fever, they'll feel unwell, they'll feel malaise, they'll have sometimes swollen lymph nodes, but then there's the classic rash that's associated with it. And certainly you can see on the screen some images of this, and of course we know that there's sexual transmission or transmission through very close contact, so it can affect the genital area, the mouth area as well. It can be very painful. We're fortunate to live in a country that has access to vaccines, and we've seen significant vaccine rollout to people at risk. And when the vaccine does a great job in preventing infection, we definitely do see some breakthrough infection, but the breakthrough infections tend to have a much milder course than that.
I want to ask you more about the vaccine. So how available is it here?
It is very much available, and it's really targeting at-risk communities. So let's not pretend that there's uniform risk across Canada. There certainly is not. It's the highest risk individuals are people who are men who have sex with men, who have multiple sexual partners, and sex workers, and that is who the vaccine is really intended for here at this point in time. And, I think there's been a reasonably successful rollout. And, obviously there's some people who would benefit from a second dose that only received a first dose. There's other people who might not have been reached yet for vaccination. But in general, the vaccine rollout has been rather well done. And you've seen the epidemic curve in Canada. 2022 summer, we had a large spike in cases, and it's come down dramatically.
Dr. Isaac Bogoch, thanks for your time. Thank you.
My pleasure.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.